Okay, we're just a couple minutes after 5 o'clock. Becky, just want to confirm that you can hear me okay and see my screen okay.
Yes, everything sounds good, looks good.
Okay, sounds good. Well, I think we'll go ahead and get started. I think we do still have folks joining us, but we'll let people join as we get started here with introductions. So first, I'd like to welcome everybody to this webinar. My name is Maggie Baldwin, and I'm the State Veterinarian and Director of the Animal Health Division at the Colorado Department of Agriculture. We have a number of really great partners that are on this evening on this webinar to talk about highly pathogenic avian influenza and give, hopefully really good, useful information to our backyard and exhibition producers. I know that highly pathogenic avian influenza has been all over. We've had a lot of news and there's been a lot of questions. And so our goal this evening is to really get you guys good information and answer some of those questions that have already come in. So I'm going to go to the next slide real quick for a brief welcome. So as I mentioned, I'm the state veterinarian, but we have a lot of partners that we're working with when we talk about high path avian influenza response, one of which is Dr. Don Beckett, who's our area veterinarian in charge with USDA. And Don, I'd like to welcome you in if you are on to give a welcome to our backyard and exhibition crew.
Thanks, Maggie. Dr. Don Beckett, the area veterinarian in charge for Colorado and Wyoming. Thanks, Maggie, for having us on. We work together hand in hand closely. Sorry, my camera doesn't work. It seemed to break today, which is perfect timing for all of you, so you don't have to see my smiling face. I think we've got a great presentation for you, and do not hesitate to ask any questions that you feel you need the answers to. That's what we're here for today. So thank you, Maggie.
You bet. Thanks so much, Don. We've got a few logistics to run through for this webinar. So I'm going to turn it over to Becky Hoffman to talk a little bit about the platform and about the translation that we have as well.
Good evening, everybody. Thank you for joining us. As you obviously are aware, we are on the Zoom platform, and we are providing interpretation in both Spanish and American Sign Language. You can see the American Sign Language going on here, and they will be alternating every 20 minutes or so. They will be switching back and forth just to give their hands a rest. And we appreciate all of those ladies being willing to be here and being able to help us. As Dr. Beckett described, we do have a Q&A. This is to get your questions answered. We would like to be able to use the Q&A feature within our platform. You will see that button down at the bottom, and you can type your questions in there. We will be answering questions at the end of the presentation. If we do not get to your question, we will use those questions to compile an FAQs of sorts that will be delivered in a post-webinar email for all of those that registered. This webinar is also being recorded and will be available on our website within the next couple of days. We will have this up, and if you need to share it with your 4-H group or your exhibition groups, any of that, it will be available for showing on the CDA YouTube channel via our website. And if you have any questions, again, just use the Q&A and we will get to those questions once we have finished the presentation. Back to you, Dr. Baldwin.
Thanks so much, Becky. Really appreciate that. And we appreciate everybody bearing with us in case we do have any technical difficulties as we work through these presentations. We've got a number of different folks that have contributed to this this evening, and sometimes the platforms don't work as well as we hope, but if we do have any issues, we'll be sure to work through them quickly and continue on with the presentations. So as far as the Q&A goes, our goal, if we can answer them, we might be able to have folks typing responses in that Q&A feature. At the end, we'll hope to get to other questions. We really do also appreciate the folks that submitted questions ahead of time, and I think most of us tried to incorporate those answers into our presentations as well. So I think let's go ahead and jump into what are we going to talk about today, this evening. We do have 2 hours slotted for this webinar. First, I'll be giving an overview of highly pathogenic avian influenza. What is the virus? A little bit of background on it, and pieces of information that'll hopefully be helpful to you all as backyard producers. Dr. Christy Pavlonia from Colorado State University will be talking about testing for the disease, what tests are available, and we'll walk through the logistics on that. Heather Ryder will be talking about National Poultry Improvement Plan and Biosecurity Preventing Disease Introduction. Dr. Morgan McCarty, our Assistant State Veterinarian with the department, will be talking about that. Dr. Rich Ann Lomkin will be giving an overview of the case investigation process. So if you have to call us and you suspect you might have HPAI, what happens at that point, and give you guys a little bit of overview of what to expect. Dr. McCarty will come back on and talk about where we are right now with our national HPAI outbreak situation. And then I'll round out just with a brief overview of our CDA poultry emergency rule that we published last week. So again, really want to thank everybody that has contributed to this webinar, and really thank all of you for taking the time this evening to join us and learn about HPAI. A reminder that we are all in this together. So, we can't do our job without all of you in the field as well. So cooperation and coordination, not only among us as state agencies, but with all of you as backyard and bird owners is paramount to disease response. So thank you so much for being present today. Okay, so I'm going to start really quickly with an overview of the Colorado poultry industry. Colorado, I know we all like to think we are a unique state. I think we are in general. And I'm going to try to move this. Becky, I just want to verify, is this bar coming up on the shared screen, or is that impeding the slides at all, or is it still looking okay on your side?
I don't see any bar, Maggie. It looks good on this side.
Okay, sometimes the presenter view looks a little bit different. So I just wanted to make sure that that was not hindering the presentation at all. So overview of, okay, thank you so much. The Colorado poultry industry, we do have a fair amount of commercial poultry in Colorado. So this is data that comes from the Rocky Mountain Regional Office. This is a report that was published last month, or 2 months ago now, in February 2022. And so for laying chickens, we had 5.12 million laid chickens in the state that produced a total of 1.56 billion eggs last year. And total chickens, we also have some broiler breeder operations in the state. So total chickens include 6.26 million with a total value of $21.9 million. And in 2017, Colorado was ranked number 15 in egg production. But as all of you know that are on the webinar, we also have a very large backyard poultry industry and exhibition industry. And included in that, we've got niche markets and specialty birds. We have one producer on the western slope that produces 75% of the world's fly tying feathers. So a very unique flock over there. We also have waterfowl and game birds in the state. So really large, diverse industry in Colorado. And for us, that is something that we have to be flexible in our response and response plans and make sure that we have all of those pieces incorporated into our response plans. So, just a brief overview of what we're looking at statewide. Okay, so we are going to hop into what is highly pathogenic avian influenza. And we're going to talk about the disease itself, the virus itself. I'm not going to dive too much into the current outbreak in this slide deck, but Morgan will talk about that a little bit at the end. So what is HPAI? So I'm going to give an overview of avian influenza in general, and then dive down a little bit into the specifics of how do we know then when it's highly pathogenic. So avian influenza, the broad category, is an influenza A virus. And the influenza A viruses for avian influenza are classified into subtypes based on surface proteins. So you see on this image on the screen of this virus, those surface proteins, we call those the H's and the N's. So I'm sure you guys have heard in the news and reading into what HPAI is, You've heard things like H5N1 or H3N2. There's a whole bunch of different combinations. There's 18 different types of H's and 11 different types of N's, and those can be made into a number of different combinations. Not all of those are highly pathogenic, but certain subtypes are highly pathogenic. And I think we'll talk about in a couple slides here, H5N1 is the current strain that we're seeing right now. So when you think about H5N1, now you know that those are those surface proteins, and that's what classifies the, how pathogenic that virus is. So avian influenza causes disease in poultry, and really all avian species are susceptible to avian influenza. And the different types of disease that's demonstrated in different species can vary, but causes disease in most poultry species like chickens, turkeys, pheasants, quail, ducks, and geese, and all kinds of other species as well. So waterfowl and shorebirds, we've heard a lot about those over the last few weeks when we talk about our surveillance. And they are, really all migratory birds can carry those influenza viruses. Oftentimes they carry avian influenza without showing clinical signs, with the exception of the subtype of H5N1. H5N1 can cause clinical disease and can cause death in waterfowl and shorebirds and those migratory birds. But generally, they carry these influenza viruses and they don't demonstrate clinical disease, but they can carry it and shed it to our domestic poultry flocks. Like I said, other migratory birds, so we typically think about waterfowl and shorebirds being our primary species that carry these diseases, but other migratory birds can as well. So highly pathogenic avian influenza. So that's the kind that causes severe disease in poultry. And we'll talk a little bit about what those clinical signs are, but it causes severe disease and also high mortality or fatality rates as well in poultry. And high path AI is always going to be an H5 or an H7. So the H type is always going to be H5 or H7 when we're talking about the high path type of avian influenza. And as I mentioned, the current strain that's circulating is H5N1. One of the pre-submitted questions was, what is the incubation period? Meaning the time from when the bird is exposed or infected to the time that they develop clinical signs or symptoms. The incubation period for high path AI is 1 to 7 days, generally on the shorter end. After exposure, they typically develop symptoms pretty quickly. Just a brief overview, high path AI or avian influenza viruses, different strains of avian influenza viruses can be transmitted to people. This particular strain that we're seeing with H5N1 is not believed to pose a risk to the general public. And we do have our state public health veterinarian, Dr. Jennifer House, on this evening, and she can talk a little bit about what they're doing on the public health side. But just so you all know, properly prepared poultry and eggs are still safe to eat. And really the risk is for folks that come into direct contact with confirmed infected poultry or wild birds. And Dr. House, I don't know if you had anything that you wanted to add on that.
No, I don't need to add anything, but I will be here for questions at the end.
Great. So if anybody has questions on the public health aspect, Dr. House is going to be on, and she can answer those in the Q&A section as well. So thanks, Dr. House, so much for being on. Okay, so when we talk about our migratory birds, I think a lot of us have heard about the flyways recently, and these are the north to south seasonal movement between breeding grounds and wintering areas for really all migratory birds. And for North America, we have 4 different flyways. And why that's important is because we do surveillance of those wild birds in those flyways to see what strains of avian influenza are circulating in general. And that gives us an early indicator as to, what we could expect for any impact for our domestic poultry. So here in Colorado, you can see we're primarily in the central flyway, but we have a little bit of overlap in the Pacific flyway over on the western slope as well. And one thing to note is, all of these flyways, we've got kind of 4 nice lines, but if you look at the north side, there's a lot of commingling that happens between the birds from all of the different flyways. So it's important to do surveillance in those different flyways, but just know that there is commingling between them as well. So they're not distinct. And if we look at the global picture of flyways, it gets even more complex. And that's why really when we look at what's happening globally with avian influenza, it gives us an early indicator of what we might see during our migratory period. So how is HPAI transmitted? We can think about it in 2 different buckets. One is direct transmission. So we have infected birds that come into contact with naive birds, and they can transmit the disease directly to naive birds in domestic poultry or any other species as well. So directly they can transmit the disease when they come into contact with each other. So they can shed it in their feces and their saliva in respiratory droplets and directly infect other poultry and other birds. But there's also indirect, which means, a person or a vehicle or a piece of equipment could pick up the virus and, transmit it to birds. And I could give a couple of examples. One example would be, you walk out in your backyard and you walk through some goose feces on your way to the chicken coop and don't change your boots, but perhaps a goose that was shedding avian influenza virus, you stepped in those feces and now it's on the bottom of your boot. And you can carry that directly into your barn or your coop if you don't wash your boots or change your boots before you go in with your poultry. So, that's why we talk a lot about biosecurity, and Dr. McCarty is going to talk about best practices to protect your backyard flock, because it can be that simple. It can be just picking it up on yourself or a piece of equipment and accidentally carrying it into your barn. Another example would be, if you go hunting or you come into contact with a wild bird somehow and, touch them directly. If you don't wash your hands before you go back to your coop, you could be carrying that virus on your hands and go back to your coop and bring the virus back to your birds that way. So again, Dr. McCarty will talk about why biosecurity and cleaning and disinfection is so important, because even if we don't become infected with the virus, we can carry it mechanically on ourselves or on our vehicles or on our equipment and bring it into a barn that way. So fatality in domestic poultry, highly pathogenic avian influenza is rapidly fatal in poultry flocks, with the death rates reaching 90 to 100%. And we're really seeing that during this outbreak in both backyard and commercial flocks. In the backyard flocks, we're seeing, very, very sudden onset and very high death rate in a very short period of time, 24 to 48 hours. We're seeing a fatality rate of up to 100%. So HPAI is pretty significant, and that's why we're having this talk with you all, so you can understand that it's scary, and there's things that you can do, steps that you can put in place to hopefully prevent it from infecting your flock. Again, I already mentioned that wild birds are typically not symptomatic, and it typically does not cause death in wild birds, with the exception of H5N1, which is what we're seeing right now. We are seeing wild bird mortalities, and in a lot of different species. So that includes, multiple species of ducks and geese. It includes hawks, Cooper's hawks and red-tailed hawks and bald eagles. We've had some mortality events with snowy owls and barn owls. So a lot of different species have been infected and affected from H5N1 in this outbreak. We did have a couple of other pre-submitted questions, asking, really broadly about avian species, what kind of other birds can transmit it. So as I mentioned, all birds are susceptible, and we really don't understand exactly the implications of things like sparrows or starlings right now in this outbreak, but all are susceptible to avian influenza. Okay, so here's a couple of pictures for you. This is confirmed HPAI, just to give you a visual of some clinical signs or some symptoms that you might see in poultry. So if you'll see on the bottom left-hand side there, I have a couple of indicators at the flock level. So if you have a large flock and you monitor things like feed and water consumption, you might have a couple of early indicators of disease in your flock, with decrease in water consumption and decrease in feed consumption. They're not drinking much, they're not eating much because they're really not feeling well. If they're laying hens, for instance, you might have a decrease in egg production, and that's something that you might notice at the flock level. When we look at the individual bird level, what do we see? Again, it can be sudden death. So we may not see any clinical signs. We might just see birds dying, and that might be, in a small flock, it might be hard to differentiate that, there's a different disease going on versus HPAI. We'll talk about that a little bit and how to know when to call. We think about HPAI as a systemic disease, meaning there's a lot of different symptoms you're going to see in the body because there's a lot of different organs that are affected in these birds. So you might see neurological signs. They've got tremors, they've got a twisted neck, they're not walking right, they might be laying down and paddling. So those would be neurologic signs. You might see respiratory signs, so difficulty breathing or gasping. Could have digestive signs where they have diarrhea. You could have depression, they're not eating right, they've got ruffled feathers. The head and neck, as you see in these, the head and legs, as you see in these pictures here, may have a purple discoloration. And you could also see swollen eyes, or as we call it, conjunctivitis. So it's really a systemic disease, and you may see a variety of different types of symptoms depending on the species that you have. But really, it's going to be a lot of birds at one time. It's not going to be, a couple here and there. And most birds in an infected flock, as we talked about, will die. The mortality rate is up to 100%. So how will I know if it's HPAI or another disease? So you may not, and that's when we just ask you to call. But typically we see a really rapid onset. We see a lot of birds sick and a lot of birds dying. And we have really great partners with CSU, also working with our veterinary community as they receive calls. We are seeing an increase of calls, in that, folks may have a couple birds sick. Always call. It's never wrong to call. We can help you wade through when we think it might be HPAI versus it might be something else. And the CSU Avian Health team is an excellent resource. So we'll talk a little bit more about that as well. So how do we diagnose HPAI? So I mentioned that Dr. Pavlonia is going to be talking about the diagnostics, what lab tests we actually do for HPAI. But it's not something that just anybody can diagnose. So HPAI it's a foreign animal disease, meaning it's a disease that we don't have in the United States. It's a disease that we don't want to have in the United States, and our goal is to keep it out, but it's reportable. So it's reportable to our offices, and it can only be diagnosed by state or federal animal health officials. And when I say that, people are like, well, who are those state and federal animal health officials? And you've met the two here in Colorado. So myself, Dr. Maggie Baldwin, state veterinarian, I'm the state animal health official here in Colorado. And you met Dr. Don Beckett during the welcome as well. And he's our federal animal health official here in Colorado as our area veterinarian in charge. So now you know who we are, and hopefully you'll know how to get a hold of us when something does go wrong. But HPAI can only be diagnosed by specially trained veterinarians that come out to collect samples. and submit them. There's a very specific process that goes into sample collection and submission because it is a reportable disease and we have a lot of steps to follow. Dr. Rich-Ann Lomkin, who's going to talk to you guys in just a little while, she is our foreign animal disease diagnostician out on the eastern side of Colorado. And she can talk about all the process that goes into place when one of them are deployed to go out and investigate a suspected case of highly pathogenic avian influenza. So who do you call if you suspect something? Of course, you can contact your veterinarian. If you have a private practicing veterinarian you work with, you can give them a call and they can walk through the process. And all of them know how to get in touch with us, either at CDA or USDA or at CSU. So you can start first with your veterinarian if you want. But you can also call us directly, the state veterinarian's office, which is my office. That's the phone number 303-869-9130. We do have a veterinarian that's on call 24 hours a day, 7 days a week. So if you call that number after hours, you will get the veterinarian on call's cell phone number, and they'll be able to walk through any questions or concerns that you do have. You can also contact the CSU Avian Health Team. And I have a little bit of a triage list at the end for you guys to know who to call when. But Heather Ryder will be talking a little bit about what their team does. But just as a heads up, that's not always answered on the nights and weekends. So, if it is an emergency after hours, a state veterinarian's office is probably going to be the best bet. And the USDA Healthy Bird Hotline, that number is the main number for USDA, and it will route to the Colorado office for USDA. Again, not typically answered on nights and weekends either. Okay, so what are our goals? So CDA, Department of Agriculture, our primary goal right now is prevention. We really want to prevent HPAI from affecting our domestic poultry in Colorado, including our backyard flocks, including our exhibition flocks. We know how hard you guys work to protect your flocks. And so our goal is to work with you and provide you the best tools to prevent HPAI from impacting your birds. But at the same time, we also really need to work on our preparedness. So in the event that we do have a case in domestic poultry in Colorado, we need to be able to respond very quickly and eliminate the threat of that virus to other flocks and other backyard flocks. So, our goal is prevention, but we're very quickly working on our preparedness and response plans as well. So preventing HPAI, how do we prevent HPAI? So we know there's no approved vaccination, so we can't vaccinate for HPAI, and there's no treatment. So if a flock or birds do get HPAI, we can't treat them. So the goal is really to maintain a closed flock and practice biosecurity. So maintaining a closed flock means not bringing in any new birds. That presents a risk for disease introduction. So don't bring in new birds, really just hunker down right now is what we're asking everybody to do. And prevent exposure to wild birds, because we know those wild birds are carrying the virus and shedding the virus. So we really want to limit that exposure to the greatest extent possible. One of the pre-submitted questions that we did have is, if we have an open range flock, how do we limit exposure to wild birds? It is challenging because naturally, if they're out in open range, you can't, unless you can enclose them or provide some sort of shelter over to prevent, at least droppings from entering from above. But biosecurity, and that's the best way we can defend our flock. And Dr. McCarty is going to talk about the Defend the Flock program and give you some of those guiding principles. So just, to give you an overview of what the response looks like. As I mentioned, our goal is prevention, but we do have a response structure in place in case we do get a case of highly pathogenic avian influenza. And this guide is available on USDA's website. And it talks you through, and this is for any flock really that is impacted by HPAI. I'm not going to go too much into the details on this slide. Dr. Lomkin is going to talk about that investigation process and that detection process and what to expect. But this is available. We do have it linked on our website as well. I did want to touch on with this group, depopulation and euthanasia. This is, it's scary as a veterinarian. This is not something I enjoy talking about because it's a hard conversation to have. But I think it's important that we touch on this and you guys understand, you know, what the reasoning is behind depopulation and euthanasia. And, you know, truthfully, in most of the backyard flocks, what we're seeing right now is rapid fatality. So most of the birds are dying before we even get to this step. They're dying from the disease. But as I mentioned, it is a high morbidity, high mortality disease. You know, euthanasia sometimes is the best step to prevent them from having to suffer from the disease. There is, again, no treatment. There is no approved vaccination strategy. And producers are not compensated for birds that die from the disease. So we've talked a little bit about indemnity process, and that applies to backyard and exhibition producers as well. We know these birds are valuable to you guys. We know for some of you, it's your livelihood. And so that can be really a hard conversation to have. And indemnity does not make everything right, but it's something that can help compensate producers that do lose birds. And again, the goal of depopulation or euthanasia is to contain the virus and prevent further spread of the disease to neighboring backyard flocks, to neighboring birds. It's really just to limit that virus from spreading. So where are we right now in Colorado? And you'll see there is a blank space because we're waiting on some additional information that I didn't have when I put these slides together. But we do not have any cases of highly pathogenic avian influenza at this point in commercial or backyard flocks. So we've only had wild bird detections. And we are updating all of these on our public facing map. As these are confirmed by USDA, we're adding those counties to our maps. And we've got a really good team of people that's helping manage all of this information, and really appreciate all of their hard work keeping track of all of this. But our wildlife services and Colorado Parks and Wildlife teams are doing the surveillance in wild birds here in Colorado. And we've had 4 counties so far that have confirmed detections. And the first was Sedgwick County. The second was Denver County, birds collected around DIA. Then we had one in Morgan County. And just in the last day, we've had a couple cases in El Paso County that have been confirmed. And I don't have all of the species in front of me right now, but I think we did get that added today to that website. So as those detections are confirmed, we are adding those to that map. So you guys, backyard exhibition, poultry owners can be aware of where are we finding that in Colorado. Again, I already mentioned it's USDA Wildlife Services and Colorado Parks and Wildlife that is doing that wild bird surveillance. So what next? Dr. McCarty, as I mentioned, is going to talk about biosecurity. That's what we're asking everybody to do right now is really enhanced biosecurity and limit that or prevent that exposure to wild birds. Monitor your flocks. If you do see anything suspicious, call us and report. So know you're normal. I think some people have disease events that happen. It's not high path AI. But if you suspect something's wrong, call. Just give us a call and we'll walk through the process with you. So this is what we have on our website. Gives you a little bit of an algorithm as far as prioritizing who to call. So if you have sick birds or birds that have died from an unknown cause, but it's not a lot of them yet, you can call the Avian Health Hotline at Colorado State University. If you have multiple sick birds or multiple birds dying, call our office, the State Veterinarian's office, or you can call the USDA Veterinary Services office as well. And wild birds, for our Colorado Parks and Wildlife folks, you can see here, they have a specific algorithm, but if there are wild birds, mortality is noticed, you can contact your local Colorado Parks and Wildlife regional office. Okay, I am going to stop there and we will stop sharing here. and Dr. Christy Pavlonia. I think we were having some issues getting Christy promoted to panelist, but there she is, Dr. Pavlonia, great. And do we need to share your presentation for you?
You can. I tried to share screen, but it says it's disabled, so you can either enable it or just share it for me.
Okay, do you want to try again now that I've stopped sharing screen? Otherwise, I'll have Dave share that for you.
It says host disabled participant screen sharing.
Okay, okay, all right. Dave, do you want to go ahead and share Christy's presentation if you've got it up?
Yes, I have it up.
Okay, excellent. Thank you so much.
Okay, hi everybody. My name is Christy Pavlonia. I'm sure there's some people that are, longtime poultry colleagues on the call, so nice to see all of you guys. Well, not see you, but at least know you're there. I work at the CSU Vet Diagnostic Lab, and I'm the lab director. And then my kind of long career here has been as a poultry diagnostician. So I really love poultry and want to keep them protected here in our state, and have worked many years to help coordinate, along with Heather Ryder, who's going to be talking later, the avian health program we run at CSU. So I'm going to only be talking about the diagnostic testing piece right now. Okay, next slide. Okay, just a quick overview of our laboratory system. We have 3 laboratories in the state of Colorado under the CSU, Colorado State University umbrella. The main lab, which is the picture in the top left, is in Fort Collins. And then we have 2 smaller branch labs in Grand Junction. We call that the Western Slope Lab. That's the picture in the bottom right. And then in the Rocky Ford area, so in Rocky Ford, Colorado. And all of our labs provide full services for all species. And specifically, we run avian influenza testing up in the Fort Collins laboratory. Next slide. This is a picture of one of our labs within our Fort Collins building. So this is a molecular lab. It's actually a biosafety level 3 lab. And it's where we are currently doing testing for highly pathogenic avian influenza virus. The picture here, they're actually not testing avian influenza samples. They're actually testing coronavirus samples. So we test for a wide variety of zoonotic organisms, which are organisms that can transmit from animals to humans, such as highly pathogenic avian influenza virus. Next slide. Our labs provide full necropsy services. So in the veterinary world, we call the examination, the postmortem examination of an animal, a necropsy. In the human world, this would be called an autopsy, so same thing. And we do provide necropsy services for all animal species, including poultry. So some of you may have interacted with our lab because you've brought by poultry or other birds for necropsy. That's in normal times. Currently, if you do have an issue with mortality in your flock, you should be calling one of those lines that Dr. Baldwin previously discussed, so that we can filter the calls and determine if your birds would need special handling and if they need to be particularly examined and tested for highly pathogenic avian influenza. But outside of that, outside of the outbreak, we always accept necropsy specimens for necropsy services, so diagnostics. And essentially what we're trying to do is determine the cause of death in your bird. The picture on the left is a picture of a bird infected with highly pathogenic avian influenza. And I know Dr. Baldwin showed a similar picture. So this is something we see sometimes with HPAI. We see edema and hemorrhage, which is essentially fluid and blood buildup in different tissues. And the reason we see this is because highly pathogenic avian influenza viruses can make blood vessels leaky. And so fluid and blood will leak out of those blood vessels and into various tissues. So again, we only see this sometimes, not always, but it is a sign of highly pathogenic avian influenza that we would be looking for. Okay, next slide. We run 2 kind of main categories of diagnostic tests for avian influenza virus. So this would be for all influenza viruses. The first type of test is a real-time PCR test. So this is a test that amplifies the RNA, which is the genetic makeup of the virus, in a diagnostic sample. And typically this is going to be a swab sample. So I have a picture of some tubes with swabs in them there. Normally for avian influenza, we're going to collect an oropharyngeal, which would be a mouth swab, or a tracheal swab, actually trying to swab in the trachea. For some bird species, we'll also take a cloacal swab, which you guys know is essentially a butt swab. And we will test those. And the way we do this testing, again, is to amplify the genetic material of the virus. And the picture below shows a computer readout of that amplification. All of the lines that are sloping upward show amplification of the virus, and that's how we read the real-time PCR. And this test will particularly pick up birds that are currently shedding virus. So we have to be able to detect virus. So birds that are currently infected. The other category of testing we run is serology testing, which are tests on serum, or which is serum as part of the blood of an animal or a person. We run typically 2 different types of tests, AGID, which is agar gel immunodiffusion, and then ELISA, which is enzyme-linked immunosorbent assay. Just 2 different types of antibody tests. They detect the antibodies, and as you know, antibodies are the immune system's response to viral infection. And antibodies can survive in a bird or in an animal for long periods of time, typically months to years. And that does exist with avian influenza virus. Birds can be positive for many months. So this type of test detects current or past infection. So if your birds had avian influenza 4 months ago, it would still come up positive on a serology test. And I'm describing that a little bit because this is the sort of test we use for a lot of general surveillance. So if you're in a commercial poultry operation and you participate in our NPIP program, we're typically running these serum tests because we're looking for not only current infection with influenza, but also past infection too. For most of our diagnostics, though, to detect highly pathogenic avian influenza in a backyard flock where you currently have mortality, we're using the PCR test because that's detecting the virus itself. And then anytime one of our labs gets a positive on a test, we always send the samples to the federal, so the USDA's National Veterinary Services Laboratory, which is in Ames, Iowa. And they'll repeat the tests and then confirm that they're positive. So it's a good way to just check results and make sure that all of the labs across the nation are getting the same results. Next slide. And then this is just a picture of our laboratory network system. It's called the National Animal Health Laboratory Network, or the NALN. And all of the, there's a lot of little icons there, but there's laboratories listed. There's over 50 labs within the NALN system. And the different icons show the different organisms, foreign animal diseases that the labs can test for. So the pink Pac-Man symbol shows or denotes labs that can test for avian influenza virus. So we do that again in our Fort Collins lab. And then it's a little hard to see on this map, but the 2 national labs are on here too, where we send the avian influenza samples again is to Ames, Iowa. And there's a blue star where that laboratory is. Our lab can do quite a lot of testing. We have a lot of high throughput capabilities, and we can test over 1,000 samples a day pretty readily and can ramp up to test more. So we're ready and prepared to respond to any outbreaks. Hopefully we won't need to, but we are available and ready to respond. And that's all I have for you today. I'm happy to take any questions in the chat box if you have any. Otherwise, I'll turn it back to Dr. Baldwin.
Excellent. Thank you so much, Dr. Papalonia. And I lost my screen that tells me who is next on our list. Dave, can you tell me who we have next? I can't find my screen again. This is part of our technical difficulties.
I'm sorry, I don't have that up either.
Okay, hang on just 1 second with us, folks, while we get this back up and running. There we go. Okay. I had closed out of mine. So up next, we've got Heather Ryder, and Heather is going to talk about the National Poultry Improvement Plan. And I think some of the folks we have online are probably participants of NPIP and know you and Christy quite well. But Heather, do you want to try and share your screen, or would it be best to have Dave share if you can't again?
I get the same response as Christy that the host is disabled participant screen sharing.
Okay, no problem. Dave,
Sorry
go
about
ahead.
that. There we go. I was actually going to guess that I was next, but just in case it was some other speaker, I just wanted to make sure I didn't step on their toes. Yeah, so my name is Heather Ryder. I am the program coordinator for what we call the Colorado Avian Health Program. So it's kind of an umbrella term. So sometimes you'll see our acronym out there. It's the CAHP. I know it's a mouthful, but kind of what that means is that we kind of fulfill a lot of different, I guess, jobs within the kind of poultry area. Chrissy talked a lot about the diagnostic side, so I'm not going to touch on that any further, but that is a big piece of who we are as the Colorado Avian Health Program. We are very much tied into that diagnostic piece, especially with the poultry testing that we do for the NPIP program that she spoke about. A lot of you guys know us because if you're in the NPIP program, you've definitely spoken to me, or you've seen my team out at your flock, out at your premise, kind of doing our NPIP certification annually. So since this is primarily in this group, a backyard flock group, there is in the NPIP program, 145E subpart 4 backyard and exhibition flocks. And I'll talk a little bit more about kind of what that NPIP program is in a minute. The other place that you might see us in the community is if you go to county fairs, and especially if you're on the Front Range, we cover about, I want to say, between 10 and 11 county fairs in a year, in that small window of county fair season in Colorado. Granted, that window is pretty narrow, so we can't hit all of them in the state because we are still a very small team, but we do hit as many as we can. And so we're there in our green bibs, and usually we have a swab in one hand and a tube in the other, and we are doing avian influenza surveillance. So that is funding that we get from cooperative agreement. A lot of states get it, and it is because when they get into avian influenza, it's always about early detection, right? We want to detect it really quick, and we want to make sure that it's contained and controlled really quick, because you heard all how devastating it can be from Dr. Baldwin, from Dr. Caplonia. So that is why we are out there at all these events with our swab in one hand and our tube in the other. Now, in a normal year, all of those are negative. And even when I talk to people, I'm like, oh, I'm sure it'll be negative. And that's true. But now we're not so sure, right? Because it's here in the United States. It's all around us. It's in Colorado, in the wild bird population, in other states nearby. So this is a different kind of year. The other place that you'll see us is at swaps and auctions and our own Colorado shows. We have the CPA show. We have the feather fanciers. So if you guys attend those shows, you've also seen us there. Again, swab in one hand, tube in the other. And that's what we're doing. We're swabbing for avian influenza, but we're also looking at the birds, just making sure we're not seeing any signs of illness before they enter the show or event. And so that's a big role. We're out there in the community. We have a huge reach with our kind of 4-H groups. So every spring when they're having their kind of poultry get-togethers, as the 4-H kids are getting ready to think about fair season, they have poultry days, and then they invite us to come and talk. And so a lot of times we'll go talk to the kids, that are going to be our future fair goers, and we talk to them about biosecurity, how to keep their birds healthy and safe, and how to manage bugs, like simple things like lice and mites. So we really do cover kind of the spectrum of poultry. So we really are an education outreach kind of program. And then Dr. Baldwin already talked a lot about our hotline. That's a really key part of our program. And in a normal year, probably the word hotline seems a little alarming, and it's mostly just a call center to help people that have poultry questions. Maybe they spent too much time with Dr. Google and they are now really confused about a certain disease like mycoplasma and what it really means. And then they call us to kind of really understand what a disease like that means for their flock. Or they do have sick birds, or they've lost birds to Merrick's and they want to submit for necropsy because it's the best diagnostic tool we have for poultry. So that number in a normal year is really just used for all sorts of poultry calls. And it's like myself on the end, and I have other staff. So really, it's not a big, scary, people on the other end. We're there to help. We're there to kind of coach you through it or kind of connect you to different resources. So maybe sometimes we all know that it's very hard to find a poultry vet or a vet that will see poultry. So we have some resources, and we might know some vets in your area that we can at least recommend you reach out to. So again, always, if you kind of run into a poultry kind of challenge and you really need just some help, just feel free to call that number on a normal time. And again, like Dr. Baldwin said, call us if you've got significant death, or actually call them. But we'll make sure we are a very close linked group. So we will make sure that we'd rather have you call somebody and we can get you to that right person than call nobody. So that's kind of the important piece of it. We're very connected. So a lot of times they'll refer stuff to us, we'll refer things to them. So anyways, that's what we are as the Colorado Avian Health Program. So now I'm going to talk a little bit about the NPIP program. We can go to the next slide. Now, I'm not going to spend a lot of time on this because right now I know the interest really is high path avian influenza, but I do want to kind of just do a little bit on this program. It's the National Poultry Improvement Plan. It's been around since the 1930s. This was back when there's two diseases. There's florum disease and fowl typhoid. And the hatcheries, the disease was in the hatcheries, and as they sent birds out, it was infecting flocks, and the U.S. industry basically, I don't know the total numbers, but it basically almost wiped out the U.S. poultry industry. So it was very significant. So what happened was industry, academia, state and federal officials came together and they formed the National Poultry Improvement Plan. So back in its early days, that was really around those two diseases. And now they are different diseases, but they have a very similar, the effect is very similar. So now we call it florum typhoid, right? So a lot of times you'll hear florum typhoid testing. And so that still remains the fundamental test of the NPIP program. So anybody that is in the NPIP, participating in the NPIP program, that florum piece is still there. Now a lot of people will say, like, well, we haven't seen this disease in a really long time, and that's true. I think it's, and maybe, and someone can correct me if I've got my years and decades off a little bit, but I think it was maybe 2009 in a turkey flock, and it wasn't a very big outbreak. We got on it really quick. So we really haven't had trouble with pullorum in the United States. Now it does still circulate overseas. So some people are like, well, do we need to keep testing for this? And the argument is, well, maybe that's why we don't have it, because this is what the foundational program is based on. And you have to have this test or have florum disease-free status to, move birds over state lines. And I am going to talk a little bit about bird movement at the end. So we do have a biannual conference that industry, state, and academia can attend. This one happens to be, hopefully it happens this year. It's been canceled due to COVID, but it's supposed to happen in Texas here in June, I think. And then that's where actually like industry, state, federal, they'll vote on rules and regulations within the NPIP program. So actually industry has a big say in kind of what is in that program. So industry kind of wants these particular testing because they don't want, our poultry industry to be impacted. All right, next slide. So I just think this picture is really good because it really shows how many, every state has an NPIP program. Some are, but it's housed a little bit different in each state. Like I said, we're part of CSU. The university, we are the official state agent for the NPIP program out here in Colorado. Some states it's with the state vet's office, and other states it might be with like a poultry federation or some other organization around poultry. But this map is really great. You can obviously see too where our kind of big poultry industries are. But as Dr. Baldwin kind of spoke about earlier, Colorado is not insignificant in poultry. I think we are like number 16 in egg production. So we do have a lot of egg production here in Colorado. But this is kind of just gives you an idea of who participates in that program. Go to the next slide. These are the different diseases. Obviously the florum and, Salmonella florum and Salmonella gallinarum, those are the foundational diseases. So what as florum typhoid that we talked about. So anybody that's an NPIP participant, when we come out annually, what we do is a little tiny prick of the brachial vein, take a little loop of blood, mix it with some antigen. We're looking for antibodies, seeing if it's present or not. That's kind of something they're used to. And then the other piece that we do for our NPIP flocks, especially our 145E backyard flocks, they're not necessarily, there is a different program for AI, or it's H5, H7 clean, but we do avian influenza surveillance. So we grab, we test their flocks annually for avian influenza. Some of our participants are actually selling birds over state lines. That's part of their business. That's why they're in the NPIP program. And to be able to do that successfully, legally, without fines and having a whole lot of trouble, they join the NPIP and they might join our H5, H7 clean. So that means every 6 months they're submitting, and this is our backyard flocks. So just to be clear, every group has different testing requirements, but since this is a backyard flock talk. So every 6 months they're submitting surveillance for avian influenza so they can ship to states that have an AI clean requirement or an AI testing. And there are a lot of states out there that have this, like Texas, Florida, and I don't want to say anymore because if I say it wrong, but we have that list in our office. So if you're looking for it, you can always give us a call. And then obviously there are mycoplasma programs. We don't have one currently in Colorado, but there are other states like hatcheries and stuff that will have mycoplasma programs as part of their NPIP. And even Newcastle, I believe, is a disease program. Okay, next slide. And so here's just kind of, again, why do people participate in the NPIP? Some people do it because, one, it just makes them feel good. They're getting a certain level of testing and connection to the poultry industry. Some people do it because in the backyard flocks, they're showing at shows and there is a florum typhoid requirement. Maybe they're showing over state lines, and to move your bird to a show in a state line, you need the florum typhoid test, or you're not doing it legally. You're not meeting that federal requirement for movement. So people join the NPIP because it makes that a lot easier, and so they're not in violation of those regulations. And so some people, it's their business, right? So they're shipping, hatching eggs, chicks, and maybe adult birds. They're moving them over state lines, so they need the NPIP program to help them do that. And like, again, it depends on your subpart and what the kind of level of testing you get, but it's sometimes it's required for an event that you're going to attend. And then two, there's an indemnity piece for large flocks tied to it. So when there is a high path or a disease outbreak like this, there's a kind of a financial piece tied to that. Next slide. This was just a quick slide. There are more subparts than this in the NPIP program. I don't want to overwhelm anybody with it, but it just kind of gives you a quick breakdown of who our NPIP participants in the state of Colorado are. Right now in our 145E, that's our commercial table egg layers, we have around 27 participants. We have, we have a meat flock. They kind of, a multiplier meat type chicken breeding flock. We, again, our 145E, that's that backyard flock. We just kind of, it's a hobbyist and exhibition poultry. We have subpart J, which is more of our game birds. So people that are game bird producers. And then we have some primary egg type and meat type producers. We have one that's in that category. So this is a little bit about the subparts that we work with in Colorado. Okay, next slide. All right, I'm not going to make you guys like study this table. No one probably on a Wednesday night late in the afternoon really wants to know numbers, but what the kind of point of this table is, this is the surveillance that we're out there doing. So really pay attention to the bottom numbers. So it's saying that that 1,700 birds of egg layers have been tested. But when you think about that, it's really not, because when we test for avian influenza, we're testing a flock. So it's really more like 1,700, flocks have been tested, or, same with our meat production, our game birds, and even our subpart E. So that's if you kind of think of it on that scale, because what you're doing is you're running avian influenza, and if it's in a flock, you're going to detect it. So, right, we don't need to test every single bird to detect it. Next one. So really kind of the big number that I want to throw out there is just that, and this is an annual kind of what we do as a program. So we're around over 8,000 birds. And this was probably, this is just kind of a rough estimate, of what we do, but you're talking about over 8,000 flocks, right, tested for avian influenza. So it's a lot of, we get a lot of reach, and some of that's coming through necropsy through our diagnostic lab. We'll grab avian influenza as part of that, just general surveillance. We go to feed stores, like I said, we get sick flocks, swaps, all the other stuff. So that's where some of those numbers come from. All right, next slide. All right, so this is, I'm just going to touch base on this just a little bit because I think this makes people really nervous, especially when high path is going on, because I'm not going to get at it to the federal level or international level with egg trade, but kind of at our local level, like if you're trying to sell, like you're a small business and you're just trying to sell over state lines, or you're trying to bring birds into Colorado. So Colorado is actually, we have, we don't have a poultry permit requirement. So if you are trying to bring birds into Colorado, that producer who's sending birds to you doesn't have to apply for a permit in Colorado. Some states do, and you always have to know what that state regulation is. So like Iowa, for instance, will have a permit requirement. Colorado does, like all states, you either have to have a CVI, so a certified certificate of veterinary inspection, or you have to have a 9-3. And the only way to get a 9-3 is to be in the NPIP program and be a part of that testing program. And so that's kind of the two ways. You either have to have a CVI or a 9-3, and that's most states. Like you're not going to get around that. And then Colorado requires a negative quorum test if you are not an NPIP flock, but if you are an NPIP participating flock, that means you've been under surveillance and that 9-3 is sufficient and you don't have to seek out that additional quorum test. But if you're not an NPIP flock, you have to get that test before you can bring birds into Colorado, or you are, you're breaking our state rules. And then again, the no poultry from quarantine flock may enter Colorado. So yeah, if there's an area that's impacted by high path AI right now and that area is under quarantine, no birds from that area can come into Colorado while that quarantine is still in effect. So I put the website on there. Our website is really easy to use actually for all animals. So it's ag.colorado.gov/poultry. But if you go to that website, you'll see it for all animals and it'll tell you the import requirements. Okay, so next slide. So what if you're wanting to, move birds out of state? Maybe you're going to an exhibition, or maybe you're selling birds. Maybe you're selling hatching eggs or chicks, like that's your business. So remember, it is always the receiving state that sets the regulation. So even though Colorado has our own set, if you're shipping to Iowa, they've got their own regulations and you have to follow them. Some of them are going to be similar, but they might have stuff in it, more than what we require. So you have to look at that state's import website so you know what that rule is. If it's up to the producer or the person shipping the birds to be in the know. And again, you could always call us and we can help you kind of navigate some of that information. But again, you're going to usually need a 9-3 or a CVI. Some are going to require additional avian influenza testing. And now if you're a kind of a high path, or you've got high path in your state, there could be additional avian influenza testing requirements in a shorter time period. And that's Texas right now. Like if you're trying to go to Texas from Colorado, we're considered a avian influenza impacted state. So you have to submit tests to me within 72 hours of wanting you to move your birds to Texas, or you cannot go into Texas. Now this isn't hatching eggs. This is like live birds that have been fed or watered. And then permits, like some states are going to require permits. So that's kind of normal period. I mean, so a lot of those are like during normal periods. So you can imagine when we get high path, I mean, some of these states can really lock down on it, where they're going to allow imports from. So just always look at that state website. There can be fines associated with it if you aren't in compliance with these rules. So it can be a headache if you kind of get caught moving birds over state lines without meeting, import and export. And this is all birds. This is all poultry, right? This is even if you're just a backyard flock and you're wanting to move to Wyoming, you have to meet their import requirements to move into that state. Okay, next slide. I think I'm getting close to the end. Yeah, and then this is because we do have a lot of people wanting to show at exhibitions and stuff. So that's another reason people do join the NPIP. They may not be selling birds, that may not be their thing, but they are going to exhibitions, right? They want to show off their cool birds, and maybe they're going to other states to do that. And so that's why they join the NPIP, because that 9-3 gets a lot easier. But if you're not NPIP and you're going out of state, you still need that CVI or 9-3 to attend that exhibition in that other state. And technically, you kind of need it to come back to Colorado. So, if you're in the NPIP, what you'll do is you'll fill out a 9-3, but you'll let us know if those birds are going and returning. And if you're going to do sale birds, then that's a separate 9-3 to let us know that those birds are getting sold. So I just kind of, I just wanted to touch on that because sometimes those regulations and moving birds, especially at a time like right now where high path, and I will tell you, states really are looking at this really close right now because states are nervous, they're worried. So this is something where, in peacetime, it's not that you should be breaking rules, but right now with kind of being in a high path, everyone's really worried. A lot of states are watching imports really, really, really carefully. So I'll leave it at that. Hopefully, I didn't mean to scare anybody, but I just kind of want people to kind of have the latest information on how that works.
Excellent. Thank you so much, Heather. Great presentation. We appreciate your partnership as always and your knowledge and expertise, not only on NPIP, but poultry in general. I know a lot of people on here, really, really appreciate you being in your role that you are at CSU. So next up, I would like to introduce Dr. Morgan McCarty. And Dr. McCarty is going to tell you all about biosecurity and all of the things we've already been talking about. How do we keep our birds safe? There's been a lot of really good questions in the Q&A. We're going to continue to answer those as we'll chat the answers back. And some of those we may talk about at the end if we have time as well. But Dr. McCarty, over to you.
Thanks, Maggie, and thanks to all the presenters tonight. And welcome, and thank you for sharing your evening with us. I think the general theme for highly pathogenic avian influenza this year, or ever, is biosecurity, biosecurity, biosecurity. And I think Maggie said it just like that, biosecurity, biosecurity, biosecurity. So what is biosecurity? And so we're going to go ahead and go through some things this evening that you can do at home, because biosecurity is everyone's job. And so we hear the term biosecurity and we throw it around, and maybe some of you are asking, well, what exactly is biosecurity? And what this is everything that we do to keep diseases, whether those are viruses, bacteria, funguses, parasites, other microorganisms, what we can do to keep those things away from the birds, away from your property, and off of you. And so really simply, these are actions that we take to keep the bad bugs out. And so we have some different types of biosecurity, and hopefully you can see the coop and the run on the slide there, and that is what we call structural biosecurity. So that's the physical construction of your coop, your pen, where you keep the birds. And so that's going to look different on everybody's operation. In this particular case, we are asking that we keep those birds cooped up, and we'll go through that in just a minute. But we also have operational biosecurity. And these are the practices and the principles that we use every day that are followed by people, whether that's yourself, whether that's folks coming onto your farm. And so it's kind of a checklist that we use that says, okay, this is what we're going to do to help prevent any of these bad bugs, in this case, avian influenza, from affecting our birds. So when we talk about biosecurity, we have to know what we're protecting against, right? And so transmission of avian influenza and understanding the transmission is going to help with how we design our biosecurity protocol or procedures. So as Dr. Baldwin mentioned, we know that direct contact with these infected birds, so your birds are out mingling with wild waterfowl or wild birds, is certainly direct contact. Indirect contact through environmental contact. So your birds are in contact with water, or, like Dr. Baldwin said, the goose poop. And so that's one way of environmental contact. Fomites, you might read about fomites, and we use fomites all the time. And we go, okay, what is the actual definition of fomites? And I do define it in another slide, but those can be the cars that are driving on your property, the equipment that you're using. So maybe the feed buckets or the water buckets, your shoes, your clothing, your hands, yourself. And then also transmission, we can potentially have airborne feathers and some dust particles. So if we understand how this disease is transmitted, we can set up some biosecurity procedures, biosecurity protocols that are going to help us prevent this disease from getting in. And you can see in this little schematic I have down on the bottom of the slide, potential direct contact, right? So we have a domestic duck and a wild duck hanging out in a pond together, and the wild duck's going back to his wild bird friends, and the domestic duck is potentially coming into contact with his poultry friends. And so we have direct transmission there. So we're going to go through a list of biosecurity basics. And the biggest biosecurity basic that we can emphasize tonight is no new bird introductions. So I put a little flock in a bubble and another flock in a bubble, and there's your flock in that bubble and all other birds in the other bubble. And if we keep your flock away from all other birds, we have no new bird introductions. This time of year, I understand that's hard, and we're going to go through, Dr. Baldwin's going to talk about the emergency rule, what that covers and what it doesn't cover. But this time of year, I know we want to get new chicks and do some flock introductions that way. You know, we're advising it's not the best thing to do. I'm going to show a little video towards the end of my presentation from Defend the Flock that does talk about new bird introductions, keeping them separate for 30 days. And of course, having to establish a biosecurity or line of separation between those two flocks. They have to be managed as two separate flocks if you do have introductions. So no new bird introductions is one of the best biosecurity measures that we can take at this point. And then keeping visitors to a minimum. This seems so basic, but at the same time, are you the only one taking care of your birds? Or are your children taking care of the birds and their friends are coming to visit? Or you have new chicks and everybody wants to come see and handle the new chicks. And so if we don't allow friends or family to come in contact with the birds, and we're only allowing the people who care for the birds, who actually understand these biosecurity principles, we have a better chance of keeping disease out. And also keeping a log of anyone who comes onto your property. So on a weekly basis, is that somebody delivering the mail on your property, UPS packages, you know, emptying the trash, and they're coming onto your property, and just knowing who those folks are can help if we have to do any sort of tracing. It also helps keep you know, those bad bugs and potentially avian influenza off of the property. So here's one, and I did see some questions in the chat regarding it, and so hopefully we can get those questions answered as far as housing all birds indoors. And so, like we talked about with transmission, if our birds are housed indoors, the likelihood that they're going to come into contact with these wild birds is greatly diminished. So we're going to protect our flock from direct contact, but we're also going to protect our flock from indirect contact. So we can see in that picture, right, that the chickens have access to this wet area. We don't know what's been in that wet area. Have there been wild birds? We certainly know that the ducks and the wild waterfowl are going to be attracted to that water. Is there feces? Are there feathers? You know, are there other potential contaminants that are hanging around that water? So if we're housing our birds indoors, we're closely monitoring one, who's in contact with them, what they're in contact with, and keeping you know, potentially wild bird contact to an absolute minimum. So there's a lot of words on this slide, and this is actually this slide and the next slide are pictures and information that I took from the Defend the Flock website, which we're going to get a little sample of in just a second. But certainly rodent control and wildlife access. So we know keeping wild birds away. So remove standing water. You know, this time of year we have snow runoff and that sort of thing. And so, you know, you can go through all of these things, but certainly, you know, the obvious things are the water and the food sources. So if we're, you know, doing a really messy job of feeding the, you know, the housed poultry, and we're having birds coming in and cleaning up and, you know, potentially coming into contact with the flock through the coop and that sort of thing, you know, we may run into some potential transmission that way. And certainly we want to keep the coops closed up really well so we don't have rodents and birds actually getting in. So preventing the wildlife from accessing the coop or the sheds or the runs. repairing holes and just really keeping a close eye. And of course, adding deterrents as well to hopefully keep wildlife and birds away, employing the decoys and scare devices. So those are just some recommendations that the USDA Defend the Flock has. And those are in PDF form. You can get online and really dig into those individually. So here's one that seems terribly obvious, right? And certainly we've all just been through or still going through a pandemic, right? Where hygiene has been emphasized. So washing your hands, washing your hands, washing your hands. It's a key component of biosecurity. And, sometimes when we're just hanging out with those little chicks, it's so tempting to hold them and, get excited, run in the house, grab a sandwich, that sort of thing. But we want to prevent all sorts of germs, not just for HPAI. So certainly, preventing bacterial diseases such as salmonella, that sort of thing. And it's always important to remember we need to remove all the organic material, which can be feathers, dirt, feces, etc., off of our hands before scrubbing them good with warm soap and water, so that way we can make sure we're getting any virus taken care of or any other potential pathogens. So really good biosecurity basic, wash your hands, just good general life lesson. Another basic biosecurity principle is changing your clothes and your footwear when going in and out of the coop. So for some folks, this might be easy. For some folks, it might not be easy, right? So wearing a pair of disposable or washable coveralls that you wear in the coop and you take them off when you leave the coop. Certainly boot covers are fantastic. You're not going to track any mud or feces or debris in. If you're wearing boot covers while you're in the coop, take them off as you leave the coop. And if boot covers aren't an option, certainly you can use a foot bath. So scrubbing all the mud and debris off of your shoes and using a disinfectant before going in the coop, and then washing before and after. So this is a kind of the same principle as washing your boots. It's washing your tools and equipment. So that can be vehicles, tractors, buckets like we talked about, the fomites that we talked about. So your clothes, equipment, vehicles again, and then disinfectants. I think that's one that we get a few questions on, and that is, what can I use as a disinfectant? Well, the EPA lists 200 disinfectants that are available for HPAI and actually are labeled for influenza A viruses. Bleach is one of them, and bleach works just fine, and it's readily available. So I would highly encourage you to use a bleach solution when disinfecting your boots and any of those fomites. And Dr. Baldwin did go through the symptoms of HPAI, and one of the biosecurity basics is know the signs and symptoms. And we don't need to go into them all in depth. These are the very same or similar pictures that Dr. Baldwin had put up earlier, but certainly knowing the signs and symptoms and being able to recognize something is wrong. And if you think something is wrong or you feel like something is wrong, absolutely call. Some of this information is repetitive, and there's a reason for that, right? So we want you to hear it a couple times, and that way it sticks. And I'll put up the contact information as well. But if you have any concerns, you see any of these symptoms or something just doesn't seem right or feel right, 100% give us a call. So that's the next slide, right? Report, report, report. And so oftentimes it's, well, what happens when I do report? Who do I call and what happens? So certainly 24/7, there's a veterinarian available at the Colorado Department of Ag in the state veterinarian's office. That's the 869-9130 number. The CSU Avian Health line is there, same number that Dr. Baldwin had given you earlier. And so if you call our office to report sick birds, what happens? your first contact will be with one of our administrative team members who have been trained to take these calls and transfer them to a veterinarian. So you'll describe what you're seeing. You may have to leave a message, but a veterinarian will call you back, and you can describe what you're seeing. The veterinarian will take down all the pertinent information, kind of a whole gamut of questions, if you will, and go through some things and try to jar your memory. What happened 2 days ago? Is there any contact with wildfowl? How many animals are diseased, or how many animals are deceased, that sort of thing. And we will make a kind of a quick assessment on the fly. Do we need to start a foreign animal disease investigation? And so once that veterinarian takes that information, there'll actually be a little bit of a veterinarian team meeting where the Colorado Department of Ag and USDA veterinarians will have a little group meeting and decide, do we need to start a foreign animal disease investigation right this second? And so you will likely be talking to a very friendly veterinarian at the Colorado Department of Ag. So that would be myself, Dr. Baldwin. You may talk to Dr. Heckendorf, Dr. Newens, Dr. Rolfe, but we'll all ask you the same questions, and the process will all be the same. So I don't want people to fear calling and asking questions. That's what we're here for. And I don't want people to fear reporting because of concerns about, depopulation. If your birds are sick, we want you to call us, and we want to work through, any situation that's happening. So please don't be afraid to call. So we talked a little bit about Defend the Flock, and Defend the Flock is USDA's website on biosecurity and keeping our backyard flocks healthy. So I'm going to show a video that Defend the Flock has put together. It really is a summary of my presentation with cooler graphics, cooler music. I guess it has music. I don't know if it's cool. It's probably not. But we'll go ahead and play that if it will work. So sometimes I'm not great at technology. So okay, let's see if it'll work. Okay, I think it wants to play again. Oh, there we go. So I think this is probably my last slide, but I did want to point out some biosecurity resources for you. And certainly USDA Defend the Flock is a fantastic website. And when we send the post webinar email out to everyone. We'll include all of these links. I'm also going to give a little update, maybe not next, but in a couple minutes after Dr. Lomkin, about the current status and the updates from the USDA. So we'll go to our state website, which will have all of these links as well. So as far as resources are concerned, you can visit our site, which is the Colorado Department of Agriculture site, the USDA Defend the Flock, or the CSU Avian Health site. So I'll be back on in just a couple minutes to talk about where we're at with a situation update, and we'll look at some of these websites again. So that's all I have.
Excellent. Thank you so much, Dr. McCarty. That was really, really great information. I think that did answer some of the questions that we've had flowing in the Q&As as well. I really appreciate all of our panelists that are helping answer these questions. You guys all have really good questions that are coming through. And so please pay attention to the presentations, and we'll try to get all of these questions answered as best as we can. So Dave is now sharing the screen for Dr. Richanne Lomkin. Dr. Lomkin, can you hear us, and are you there?
I am here. Can you hear me?
Maggie, can I just interject something? I've had a few people raise their hands. I'd just like to remind everyone that we are using the Q&A for questions. So please do use that, as we will not be doing the raise hands in this presentation.
Becky, thank you so much for that reminder. Yes, please use the Q&A function for all of those questions. And Dr. Lomkin is labeled as Sonia in this presentation, but Dr. Lomkin, you can go ahead and get started with your presentation. Thank you.
I've never been Sonia before. That's pretty cool. Okay, so hello everyone, and I'm glad that I was able to join you. The wind is playing absolute havoc with my internet connections out here in Eastern Colorado. So I don't have the video capability, but I do have audio. And Dave is going to get to change my slides for me. Thank you very much, Dave. Dave has been saving me all day. So Dave, if you could go ahead and move on to the next slide. I'm going to talk about the backyard investigation. So what happens if you do have the extreme misfortune to find some depressed chickens in your flock, and then the next day you've got 4 or 5, unfortunately 10 or 12 that are dead. You call the state veterinarian's office or the avian health program, and they refer you to a foreign animal disease investigator, and that would be me. So I am going to talk through these slides as if I am doing this investigation. There are several of us in the state that could be doing these investigations, but it's just easier for me to use the first person for these slides. So the first thing that I am going to do once a case has been turned over to me is I will call the flock owner or manager and talk to you specifically about what's going on with your flock. I'll also ask you about your biosecurity protocols, because I don't want to be the one to break your biosecurity. And so I'm going to ask you what I need to do to safely enter your flock. What do you have set up for visitors to your flock? And then I will follow all of your recommendations, as well as the protocols that we have in place as well, to protect both myself and your chickens from anything I potentially could be bringing on, and also to keep me from taking anything from your flock to anywhere else with me. Then I'm going to ask you questions about what type and how many birds do you have, because that's actually going to make a lot of difference in terms of what kind of samples that I need to take and how many swabs and vials I need to bring in with me. And I need to get all of that prepared before I come onto your farm, because that all needs to be part of the biosecurity. And then finally, I'm going to talk to you a little bit about whether you will be able to assist me, or whether I need to maybe try to find someone that works with us to come help. If your birds are free range, if we have to do this during the day, and so therefore we may need to have some assistance catching them. What we have seen with the high path avian influenza is that it is unfortunately hitting these flocks hard enough and fast enough that probably there will be some birds that are sick enough we can catch them, even if it is broad daylight. But that is something that we will need to talk about before I even leave home to head your direction. Once I arrive at the farm, then of course we'll navigate that biosecurity to get in. I'll have another quick discussion with you about whether you've moved any birds on or off your facility within the last 14 days. We'll also find out if you can pinpoint something that you feel may have caused this. You know, do you have a pond on your premises and you saw a bunch of wild ducks there 2 or 3 days ago? Did the neighbor's dog get a dead bird from the river and bring it home, something like that? So do you have anything like that in mind as to where you may have gotten this illness in your birds? Next slide, please, Dave. Then we're gonna collect samples, and so I'll want to start with any birds that look ill, look sick, but aren't dead yet, and I'll want to take either oropharyngeal swabs from their throat, like Dr. Pavlonia discussed, or if they're waterfowl, cloacal swab. And so we'll do that on any birds that look ill. And then if you have any that are freshly dead, so any that have died, depending on how hot it is outdoors, any that have died within the last couple of hours, if it's been a really, really cool day, maybe I could collect them that have been dead a little longer than that. But the samples quickly decay with time as the bird is dead. Unfortunately, the birds can still be infectious. The dead birds can still be infectious. It just is harder for us to get samples that will gain us anything. So we'll collect those samples, package those samples, and get them ready to ship. I may have somebody else meet me there at the front gate so that I can literally toss them the samples, put them in a clean bag, and then that person can then go ahead and take care of getting them shipped. Maybe run them directly up to CSU for their analysis, so that we can get answers more quickly. We may not have the personnel to be able to do something like that, so I may end up shipping them on my way up to CSU to get them the samples. So that will be kind of dependent on the situation. And then we'll have another discussion with a farm owner. So next slide, please, Dave. And so once we've got the samples taken care of, if hopefully someone else has taken care of shipping them or taking them up to CSU, I will stay on the farm and sit down and have a longer, more in-depth conversation with the owner, because we're going to need to talk about carcass disposal plans. You're probably calling us because you've got several dead birds already. More may have died in the time it took me to get there. What are we going to do with these dead birds so that we are not spreading this virus through the neighborhood and or other neighborhoods? If, for instance, we were to just throw them in the trash can, the trash company comes, picks that up, and then stops at multiple other places. That could spread it throughout the area. So we need to think about that. We need to talk about different options for those carcasses, and we need to talk about options for how we may end up needing to euthanize the remainder of your birds. And that's a really terrible discussion, but we need to go ahead and face it. I firmly believe in facing the worst case scenario and being prepared for it, and then hopefully that worst case scenario won't come to play, and we'll get to follow plan B instead of plan D. Some other foreign animal disease diagnosticians might not be quite that fatalistic, but certainly we will all broach those subjects. If your birds are severely ill and you want to go ahead and euthanize them to end their suffering, then we may be able to help you with that. at the time that we take the diagnostic samples, but know that we can't offer you indemnity until we have a positive sample for high path avian influenza. And so we'll need to have that discussion as well. We'll want to talk about the amount of feed that you have on hand, because that can certainly carry the virus. Although it's painful, all your birds are dead, you know, it might be nice to be able to donate that feed to someone else, or to an animal shelter or something like that. We can't do that because it can be contaminated with the virus. We don't want to spread it anywhere else. So we're going to have to destroy that feed that you have left. And then we're also going to talk about any concerns that your family or employees may have about their exposure to the chickens, and certainly we'll call public health in to assist us with those type of conversations. So far, we haven't had any humans that have been affected by this virus in the United States. Hopefully, it will remain that way. But certainly, we need to be understand that it could mutate, and or we could find, unfortunately, someone who is more sensitive to it. And so we need to keep that in mind. Certainly, in the past, we have seen that there have been cases where an outbreak has started, no humans were sick, and then as the outbreak has continued, we've had people get sick, and even in a couple cases, people die during an outbreak situation. So certainly a discussion that we also need to have. Finally, we need to talk, well, not finally, this is actually my second to last slide. We need to also talk about inventory. How many birds do you have? What kind of birds do you have? Are they organic? Are they free range? Are they heritage species? That was one that I saw in the questions, heritage and rare breeds. Do you have purchase receipts for these birds? Do you have sales receipts that you can base your values on these birds on? We can pay you indemnity if these birds come back positive for high path avian influenza, but we need to base those values on something, and it's a fair market value. So even though the birds are pets and precious to you, we still have to be fair with the taxpayers who are paying the bill, and so we will look for receipts and invoices and things like that will show us the value for the birds. Next slide, please. So discussion, we talked a little bit about euthanasia options for the farm a little earlier. There are certainly different kinds of euthanasia options out there, dependent on the type of poultry, chickens versus ducks and geese, versus peacocks and turkeys. So the different kinds of poultry give us different challenges as far as euthanasia options. Certainly, we can consider lethal injection like we do with dogs and cats. We also can use carbon dioxide in an enclosed container. That actually works very well, and the birds asphyxiate very, very quickly. If the container is dark, first we let them get drowsy before we introduce the CO2, and it works very, very well. There are other options that are available. So it just, again, depends on the type of poultry and how many we're looking at. Unfortunately, again, as I've said several times, the way this outbreak is going, most of these birds are dead before we ever get a diagnosis from the virus itself. And so we actually haven't had to worry too much about how we're depopulating the backyard farms, because the dang virus is doing it for us, which is not something we like, because we don't want these animals to have to suffer through the illness. It's better if we can get it far enough ahead of it so that we're able to euthanize them quickly. Then, as we discussed, disposal options. What are we going to do with those bird carcasses? What are we doing with leftover feed? Any eggs that you have on hand have to be destroyed because of the risk of their containing virus, and also the manure in your chicken coop, in any outdoor runs. How are we going to handle all of that? Then we are going to talk about virus elimination on your farm, and that is something that we need to discuss. And again, there are multiple options. The things that Dr. McCarty talked about for disinfection and biosecurity also are true for virus elimination if your farm is infected. And so we will talk through that, how we want to do that. We'll talk about restocking plans. How are you going to want to restock your farm? When are you going to want to restock your farm? And that may make our decisions on a couple of these other points narrow those options down as far as when and if you want to restock. And then any other questions that you have, this is the time to ask us, because once we get a positive diagnosis, then things are going to happen really quickly. So when we're there doing the investigation, any questions that we can answer at that time will really help both of us, actually, because a lot of times your questions either jog our memory that, oh yeah, we'll need to talk about that, or bring up a point that we hadn't even thought of. So we always like it when you can come up with questions. Next slide, please. That might be my last one. There we go. Okay, so these are just a couple pictures from 2015. Actually, this might even be 2014 outbreak up in Oregon, and these were in backyard birds. And these are just the responders out there sampling some birds in that particular situation. I actually think this was surveillance sampling. So we get dressed up like this even to do surveillance sampling in an area where there has been infected flocks, because we want to be absolutely sure we're not bringing anything onto your farm and that we're not taking anything off of your farm as far as diseases. That is all I have. Thank you very much for your attention. And I hope that you've learned something and that you've had some good questions.
Thank you so much, Dr. Lumpkin. That presentation was excellent. And I think it's really helpful for our backyard bird owners to know and understand, what to expect when they call us. So as Dr. McCarty said, when you call us, you're going to be talking to one of us that you see presenting here on the screen. So it's not going to be somebody else hiding behind a curtain that you're going to have to talk to. There are a few additional veterinarians on our team, but we are the people you would be talking to when you call to report, as well as our CSU partners. And I think, having Dr. Lumpkin walk through the process of what to expect when you call, hopefully alleviate some of those fears and concerns. I'm sure it also still raises some questions, but I think that is really helpful. So Dr. McCarty is going to give a brief overview of where we are in the current situation for avian influenza. And while she presents these websites, I'm going to drop the links to those websites in the chat box for you as well. And then we will conclude talking about our emergency rule. And there's a lot of questions here in the Q&A on shows and fairs and such, and we'll talk about that at the end as well. So thanks. Go ahead, Dr. McCarty.
Great. Thanks, Dr. Lumpkin, Dr. Baldwin. So this is going to be really brief. It's just a situation report kind of nationally and in the state, and where to find this information. Like Dr. Baldwin said, she's going to drop those into the chat so you can click on them now, bookmark them, that sort of thing. They'll also be in the post webinar email. I'm going to talk a little bit quick because there's a lot of interest in this emergency rule, and I want to allow enough time for Dr. Baldwin to really go through that. So this is our HPAI webpage, and this is where a lot of those links, or all of those links, can be found. Phone numbers, that sort of thing. So I just wanted to go through this with you really quick. And then certainly we do have a situation map, a Colorado situation map on our website. And you can see the blue counties are wild birds, red counties are domestic, purple counties are both. And we don't have any domestic detections in Colorado. So you're just going to see those blue counties. If you click on them, you can see the name of the county and what the detection was. So you'll get county level information, and then that's it. So that's our state detection map. And then, like I said, here are some really important links. And our webinar that was posted for tonight is on here. There's some videos. And the webinar that we're doing tonight will be posted under videos, the Defend the Flock site. So I just wanted to go through those really quick. And then I wanted to go through the USDA. These are on our website, does post the confirmed detections. This happens to be the wild bird detections, state, county, what the animal actually was and how it was found. So Minnesota, Dakota County 331 was a wild bird mortality. And so you can go through all of these. Certainly there's a map that the USDA offers on how many detections in each state. And you can see, unfortunately, Colorado has made its mark on the map for those wild bird detections. The USDA also does offer the same thing for backyard and commercial flock detections. You will not see Colorado on here because we do not have any, so that's fantastic. They will keep it at county level. So the state, the county, the date, and what the actual species affected were, what the flock size was. So the national report is updated. Don could probably tell us how often it's updated, but once those confirmations are made by the USDA, they are put on these websites for both the wild and the commercial and backyard flock detection. So if you have any questions about where to find this information, USDA or our avian influenza website. We also, which is here, we also do have the Colorado Parks and Wildlife avian influenza sheet. Dr. Baldwin did mention if you have a high number of wild bird mortalities, you can visit this site and go over those. So I apologize, that's my really brief situation report, but like I said, I'd like to turn it over to Dr. Baldwin to really discuss this emergency rule because I know so many of you are interested in that. I hope you all enjoyed the presentation tonight, and I'll turn it over to Dr. Baldwin.
Thank you so much, Dr. McCarty. And actually, Morgan, if you could drop in the chat the link to the emergency rule, or at least to CDA's website, or perhaps Sonia could do that as well, so folks can access the actual language of the rule. What I want everybody to know is that a lot of time and thought and consideration went into putting this emergency rule in place. This is not something that we take lightly, and I know it impacts a lot of you as backyard producers and exhibition bird owners as well. So this was something that we really carefully thought about, and we thought about the impacts that this emergency rule has before we took action on it. I really want you guys to understand that this is not something that we take lightly. Dr. McCarty will drop that link in the chat if you want to read the full text of the rule. The emergency rule was drafted early last week and passed at the Colorado Ag Commission on Wednesday of last week. And this rule suspends all commingling events for purposes of sale, show, or other types of events where poultry would come together on a premises. The intent of this rule is really to prevent commingling, so to prevent birds from more than one premises coming together. What we've said all along throughout this whole webinar is we want you all to maintain a closed flock, and that's really the best way that we can protect our flocks. And when we have things like a swap or a large exhibition event where a lot of birds come together, we really see a potential impact for a lot of premises that may be involved. So I can give you an example. If we had a poultry swap where we had, say, 12 different participants with birds from 12 different flocks that come together to one premises, and we have a detection of highly pathogenic avian influenza in one of those flocks, and they had been at this event, all of those flocks would be considered exposed. And that is, just a risk that right now is not worth taking because we know it presents a threat to your own flocks at home. So this rule really is to prevent commingling events. We've had a lot of questions regarding farm and ranch stores. And so if farm and ranch stores are single sourcing all of their birds from one premises and bringing those to one premises, that wouldn't be against the rule. They could continue to sell because they're not commingling birds from multiple premises. But for you all, it's still going to present a risk if you have a flock at home and you go to a local farm and ranch store and buy those birds. That's not maintaining a closed flock. So we're really discouraging folks from bringing new flocks in right now. If you have to, quarantine, you could probably see through some of the Q&As, we talked about quarantine for 21 days after arrival, but not commingling and not mixing those birds with your own flock at home. So that's just a really high level overview of the emergency rule. And a lot of other questions have come in the Q&A on specifically, is this going to impact shows and fairs, and kind of how long are we going to expect this outbreak to go on? So I'm going to be perfectly blunt. We don't know. We've never really seen an outbreak of this magnitude. We've never really seen this level of virus in wild birds that present a significant risk to our domestic poultry. So it's really hard to predict what's going to happen in the wild. There's not a lot of measures that we can take to prevent additional spread of this disease in the wild birds. And so if it continues to, spread and expand in our wild bird population, that's going to present a longer period of time that we're going to see that, being a risk to our domestic poultry. So I hate to give a general answer, as we don't know, but we truly do not know how long this is going to go on. Maybe once we get through this migratory season, we may see cases die off. And, what we've been seeing with those numbers that Dr. McCarty had mentioned on the domestic cases, it's really been single source introductions from wild birds. So we did have an outbreak. I think many of you probably remember our outbreak in 2014, 2015, where we had HPAI in wild birds. But a lot of the transmission that we saw during that outbreak was actually farm to farm spread because we didn't have good biosecurity practices in place. So I think our surveillance that our wildlife partners and USDA Wildlife Services and the surveillance that Colorado Parks and Wildlife is doing, that's going to give us an indication of, how much more is this virus circulating in the wild bird population. And it's also going to, give us that indicator as, are we seeing less virus in the wild bird population? And maybe is this thing dying down a little bit? So we just have to get additional surveillance to see what that does in the wild bird population. But one thing is true is that biosecurity, everybody practicing enhanced biosecurity, is going to limit that virus from continuing to replicate and continuing to spread in our domestic birds. So in our domestic flocks, we really need to implement that biosecurity to prevent that transmission. So as far as county fairs and shows go, to give you an overview, in 2014 and 2015, we saw cases into June. So our emergency rule is in place through June. If we see continued spread of the virus and continued cases, we could extend that emergency rule to be in place longer to, continue to limit commingling events in the state. But we put that in place to give us enough time to get through this migratory period, to see what cases, how cases progress this spring and in early summer, and then give us confidence to know if we can ease those restrictions and let business return to normal. But this is something that we're taking very seriously. It's something that, as the picture of the outbreak changes, we will be sure to communicate that not only to the general public, but to you all as backyard and exhibition flock owners, to extension agents. We are working with Reagan Adams, and we are working with CSU in general. You saw many of the CSU colleagues on here this evening, and we'll be sure to get that information out and give you guys an idea of how we expect this outbreak to go. So I think that brings us to the end of this presentation. We have just a few minutes left, and I wanted to touch base with Dr. McCarty, Dr. Beckett, see if there's any other burning questions that are in the Q&A that you think we need to answer live, or Dr. Lonkin or Dr. Pavlonia, please feel free to hop in if there's anything that you guys think we need to address with the whole group.
Oh, my thanks, Maggie, to all the presenters. I will tell you, a lot of information covered in a short period of time, and I'm sure there are many, many more questions that are floating out there. And I will tell you that the people that we have responding to this are empathetic. They don't want to have to respond. And so we prefer that you practice good biosecurity and prevent your flock from getting it. But be assured that if your flock does get infected, that we will do all we can to assist you and be there for you and walk you through the process. Thanks, Maggie.
Thank you so much, Dr. Beckett. We will be putting together a post-webinar email with the resources that we talked about during the webinar. There was a lot that we threw at you, and we know sometimes in a short period of time that can be very overwhelming. So we'll be sharing that in an email. This, as you know, is being recorded, and we will be posting this recording so you guys can refer back to it at any point in time. Please share this information. The more that we can get good information out there, the more we can help protect our flocks. And so I'm going to ask Becky really quick. Becky, are we able to keep this line open to answer the rest of these chats, or maybe we can save all of the questions and put that in the post-webinar email? Is that a possibility?
Yes, we will get all of these questions in once the video downloads and the audio. It will also send me a list of all of the questions in the Q&A. So that will be included, like I said, in the recording that is on the CDA YouTube. I know a few of you asked if the slides would be available, and just in case you didn't see that answer, the slides are not going to be available, but you will see those slides on these recordings.
Thank you so much, Becky. I do see more questions continuing to roll in, so we'll be sure to get those answered and attach all of those questions. You guys had really great questions throughout the webinar, and I think it's really important for everybody to read through those. So again, thank you all for taking the time this evening. 2 hours is a lot to ask of your time, but we really hope that this has been beneficial for you all. And now you guys can put faces with our names, and you know who's essentially directing the response here in Colorado. We greatly appreciate you taking the time. Like I said at the beginning, we're all in this together. We're all partners in this, and we can't do our jobs without you all as producers. We know how much your birds mean to you, and they mean the same to us. We take our jobs pretty seriously, and I hope that came through on this presentation. So thank you all so much. Have a good evening. Take care, and defend the flock.